had uncontrolled high blood pressure, and 14% had resistant hypertension. The Harvard-led study found that moderate or severe sleep apnea was associated with more than twice the odds of having resistant hypertension. The study was published in the American Heart Association journal, Circulation. In today's Ask the Experts segment, we spoke with Dr. Christine Horner, a surgeon and author, and asked her to elaborate further on sleep apnea.
Sleep apnea is when you actually stop breathing while you're sleeping. Most people think of it as an overweight, snoring man's disease, and it's true that if you're overweight and you're a man, you have an increased risk of developing it. This is a diet and lifestyle, kind of thing. If you're drinking excessive alcohol in the evening, taking sleeping medication, eating heavy meals too late at night, all these things will increase your risk of sleep apnea. I mean, a lot of times it's just like when you're observing someone who's doing that, it's like they might be snoring and then they just stop and they're not breathing at all. And then they start to breathe again. So there's a few seconds of not breathing. Now, women oftentimes don't snore, and what they'll have is much more subtle symptoms, like in the morning they'll feel maybe daytime sleepiness, mild headaches, that kind of thing. Most people don't know that they have it. If they have a bed partner, that person could say, hey, like when you're during the night, I can hear that you're not breathing for several seconds. So the way that it's diagnosed is you go to a sleep lab, and they have to hook you up to all these, electrical equipment and kind of monitor you and determine if you have it, and if you do, how severe it is. And then there's certain treatments that can be as simple as losing weight, keeping your head elevated, kind of on a wedge. And then they also have something called a CPAP mask. It's called a continuous positive airway pressure mask that you can wear at night. So the reason you don't want sleep apnea is it will increase your risk of heart disease, high blood pressure, kidney disease, and so forth. So it's important to get it treated. And 90% of people who have it don't know that they have it.
And that was surgeon and author Dr. Christine Horner speaking with us about sleep apnea. If you have a medical question that you would like to have answered, tweet me at Linor Moudou, and we'll have a medical expert respond to your query. And that's our health report for today. Back to you, Vincent.